Gukinyiria riu AIKARI makiria ma 300,000 kuma kaunti-ini ya Kiambu ni marikitie kwandikithio mubango-ini wa kwamukira motungata ma ugima wa mwiri wa Kiambu AFYA, mubango uria ukoretwo ugikinyanirio ni gavana wa kaunti-ino KIMANI wa MATANGI. Kuringana na gavana wa kaunti-ino, matanya ma thirikari ni gukinyira family makiria ma 500,000. Undu uyu akiuga ni ugukorwo ugiteithiriria kuhuthia garama ya marihi ma thibitari maria makoretwo makigumira namba nene ya Akenya.
Ndatangathire mwaka uyu wathirire ngira andu moimire twandikithia andu ndendaga kwandika andu milioni 1 aria moimirire twandikite riu tukinyitie hakuhe andu 400,000. Ndirenda ona twanyihia tukorwo twina andu aitu 600,000.
Thirikari ya kaunti ino iranire guthie na mbere na gukinyiria muingi motungata matiganite ma uthii wa na mbere na gukinyiria riu thibitari cia ikiro cia level 2 no irathie na mbere na gwakwa icigo-ini itiganite cia kaunti ino.
I can authoritatively say that Kiambu AFYA has really impacted positively on our community. We've had at the community level challenges of members of the public not being able to access health care. But now it is easy because they come to the facilities, they are offered services or the services that they come wanting to be offered to them.
Many of the programs, they don't cover chronic illnesses like hypertension, diabetes, asthma, cancer. But for Kiambu AFYA UHC program, we have agreed that they are going to cover chronic illnesses.
Mwena-ini wao AIKARI meranire kunyitanira na thirikari niguo kurutithania wira na njira ya hamwe, magitariria mubango wa UHC ugukorwo ukimaura murigo munene wa garama ya marihi ma thibitari.
Nashukuru sana serikali ya Kiambu County kwa kutupea hii card, ni natusaidia sana. Imenisaidia kutibiwa, unaweza tibiwa hata Kenyatta. Nilitibiwa Kenyatta na nikatibiwa KU.
Itanisaidia kunisimamia wakati nitajifungua mtoto kwa bili yote. Kila kitu yenye nita check up nini zote nitasimamiwa. Sasa mimi naweza sema asanti kwa kwa Matangi.
Handu-ini ha Kameme TV ritwa riakwa ni Wambui wa Njuguna.